Hi, we're here with Dr. Ralph Poppenbeek, occupational physician. And I had a question that's often presented to us, and that is, when you're making an assessment, how much emphasis do you place on the history, the examination, and the radiology?
The thing that's most relevant in those three issues is consistency. In other words, with the history, there are two phases. One is the history of the person's occupation, and the other is the history of the injury. They have to correlate, obviously. The examination findings are to support what your working diagnosis is from your taking a detailed history. The radiology is another matter altogether. It's important to be able to understand radiology reports. Now, surgeons might contradict this because I think they like to look at the X-rays. I too like to look at X-rays and films, but I tend to rely on the radiologist. Now, you've got to correlate the radiology findings with what your tentative diagnosis is on the basis of the history and examination findings. Now, in the present climate where we can't actually examine people very objectively, we have to rely heavily on the history, which is no big problem because that's where you make most of your diagnostic assessments anyway. Now, that has to correlate with the radiology. A lot of people seem to have difficulty in doing that. I've seen a number of patients who've had pain, for instance, at the thoracolumbar region. Now, they have CTs, MRIs, all the works, and it shows they've got a discogenic problem at L4-5. Now, that's irrelevant if they've got thoracolumbar pain because it's a completely different part of the spine. So you would disregard that X-ray report unless it showed some changes at T12L1. And I think it requires a lot of experience to be able to make that judgment call. So consistency is the important thing. And then you can make some predictive statements regarding your observations and findings.
Right. Thank you for that.